Introduction: Acyclovir is an antiviral drug primarily used for the treatment of infections caused by the herpes virus group. It is a synthetic analog of guanine nucleoside and is highly selective for virus-infected cells. Drug class: antiviral drug, nucleoside analog, anti-herpes virus. Agent: mechanism of action: acyclovir works by inhibiting viral DNA synthesis inside infected cells. Acyclovir is first converted to acyclovir monophosphate by the viral enzyme thymidine kinasate, is then converted to its active form acyclovir triphosphate by host cell enzymes. Acyclovir triphosphate competitively inhibits viral DNA. Polymerase causes chain termination of viral DNA. This prevents viral replication without significantly affecting normal cell spectrum of activity. Acyclovir is effective against herpes simplex virus type 1, HSV-1, herpes simplex virus type 2, HSV-2, varicella zoster virus, VZV, less active against Epstein-Barr virus, not effective against CMV. Uses/indications: acyclovir is used in herpes simplex infections, oral and genital herpes, herpes labialis, cold sores, herpes encephalitis, varicella, chickenpox, herpes zoster, shingles, prophylaxis in immunocompromised patients, HIV, transplant patients. Dosage form: Serol tablet, Serol suspension, intravenous injection, topical cream/ointment. Pharmacokinetics: absorption, poor oral bioavailability, 15 to 30%. Distribution: good distribution, crosses blood-brain barrier. Metabolism: minimal excretion, renally excreted. Dose adjustment required in renal impairment. Half-life: 2 to 3 hours, prolonged in renal failure. Side effects: common side effects: nausea, vomiting, diarrhea, headache. Serious side effects: nephrotoxicity, especially for use, neurotoxicity, confusion, tremors, crystalluria, due to dehydration. Precautions: ensure adequate hydration. Dose adjustment in renal impairment. Use cautiously in elderly patients. Drug interactions: increased nephrotoxicity with aminoglycosides or cyclosporin. Probenecid may increase acyclovir levels. Contraindications: hypersensitivity to acyclovir or valacyclovir. Special note: yearly treatment improves outcomes. Valacyclovir is a prodrug with better oral bioavailability. Acyclovir is virostatic, not virucidal. If you want, I can also provide short exam notes, MCQs comparison with valacyclovir and famciclovir, SEO optimized YouTube description and hashtags.